Depression doesn't automatically end your trucking career. That's the first thing to understand, and it's the part most drivers don't know. The FMCSA doesn't hand out a list of mental health diagnoses that automatically disqualify you. What they require, under federal regulations, is that a driver not have any mental or psychiatric condition likely to interfere with safe driving. The key word there is likely. That means your DOT medical examiner is looking at your specific situation, not just your diagnosis. So the real question isn't whether you have depression, it's whether your depression or anything you're taking to treat it could affect your ability to safely operate a commercial vehicle. Those are two very different questions. Let's talk about medication, because this is where a lot of drivers get nervous. The FMCSA does not automatically disqualify you for taking antidepressants, but your examiner is going to look closely at what you're taking and how it affects you. Some antidepressants can cause drowsiness, slowed reaction time, or blurred vision. Certain sedating medications, or benzodiazepines, sometimes prescribed alongside depression treatment. Those raise more concerns. Stability matters here. A driver who's been on the same well-tolerated medication for a long time, functioning normally, is in a different position than someone who just started something new and hasn't settled in yet. When you come in for your DOT physical, you'll fill out a health history form. It will ask about mental health conditions and medications. Answer it honestly. Falsifying that form is a federal violation. It's not worth it, and examiners are trained to ask follow-up questions anyway. If you disclose depression, your examiner may ask about your symptoms, your treatment, and how well things are controlled. They may ask for a letter from your mental health provider confirming that your condition is stable and that you're cleared for safety-sensitive work. That kind of documentation isn't a red flag. It actually helps. It gives the examiner what they need to make a fair decision in your favor. Here's what you can do right now to protect yourself. Stay consistent with your treatment. Don't skip doses or switch medications right before a physical. Keep your prescribing provider informed about any side effects. And when you sit down with your DOT examiner, be upfront. Bring documentation if you have it. An examiner who knows the FMCSA standards and works with drivers on complex health situations can walk you through exactly what's needed. Getting help for depression is not a career-ending move. Hiding it and hoping no one notices. That's the bigger risk. If you're in the Central Valley and need a DOT physical, you can learn more and schedule at .modesto.com.